Today, we're going to be talking about histamines. And this is, of course, really relevant as we hit the springtime. And we're going to be going through all kinds of really important pieces that Dr. Rosalie and I were able to uncover via our research about histamines. And we wanted to make sure that these were very accessible to you guys. So if you have questions, we will answer them at the end. Just put them in the chat. So I'm Dr. Molly Force. I'm the owner and clinical director here at Prosper Natural Health. And I'm joined by Dr. Rosalie de Lombaert. And this is such a pleasure for us to be able to have these monthly spotlights where we get to really dig into specific patient questions that come up and topics. And as is very relevant right now, histamines are kind of becoming more of a topic that we see cropping up in research, but then we also see it coming in more from patients asking about do you think I might have histamine intolerance? So some of the things that we're going to be covering today are what histamines do in the body. Are they friends? Are they foes? Are they somewhere in between? And then we're going to be talking about natural antihistamine remedies that we see very clearly in the medical literature and ways that we can be addressing our own histamine load. So histamine itself is this very important signaling molecule that's used by most of our cells. And it is essentially an immune response that is released from these cells that are typically mast cells. There's another kind of cells, basophils, which also can release these. But you can see this little mast cell, this purple cell over on the right-hand side of the slide. And you can see these green packets. Now, these are packets that are filled with the signaling molecule, which is histamine. And what happens is when the mast cell is triggered, it'll release packets of this histamine. And histamine is pretty cool because it's this signaling neurotransmitter and it's even our neuromodulator. And it causes what we often associate to be allergy symptoms. So, one of the most important reasons our body does this and how it can be helpful is that it helps with these histamines, it helps our cells tag foreign invaders. So, especially when we're thinking about ways that our body is helping us protect from infections, histamine is a really important component of this. Now, histamine is made from an essential amino acid, histidine. And it's important to take a second and say, okay, essential means it's required. So, we have to have histidine in order to make histamine, and we have to have histidine as one of our important proteins in order to survive, and histamine is that important to our survival that it's one of these required pieces. Now, there are four main receptor types on our cells for histamine and where it can bind. And this becomes important as we think about different ways to block histamines when we have excessive amounts of histamines and when we're talking about certain medications and certain natural remedies. And it's also important to know that histamine itself is really broken down in the body by a specific enzyme. And we're going to jump into that more, but it's called the DAO enzyme, and that becomes important for us. When we think about histamine sources, there are three main ways that our body gets histamines, either by ingesting it through foods that may contain histamines, or it could have to do with our immune cells, those mast cells and basophils opening up these histamine packets in an immune response. And then we also know that our microbiome is responsible in a huge way for our histamine sources. And then, so over on the side of this slide, we thought this was really interesting. There are all kinds of intestinal disorders that can happen when we have excess histamines. And we see this here, this little picture of the small intestine with its brush borders. You can see those finger-like projections on the cells. And the enzyme that regulates histamine lives right on top of that, the DAO does. And when we have too many histamines, we can have all kinds of problems that really affect the digestive system, such as food allergies. We're going to talk in detail today about histamine intolerance, but also things like inflammatory bowel disease. Now, these are autoimmunities that affect the intestinal system. Irritable bowel syndrome can also really be involved with histamine. And then we're going to talk about scrumboid poisoning, which is kind of an interesting one that happens from canned fish. And then also even colorectal cancer. So when we're thinking about colon cancer, it's not necessarily something people would think like, oh, that's involved, histamine's involved there, but it actually is, which can be important for us as well.
So what does histamine do in the body? It's just this little moving molecule that actually has some far-reaching effects. So when it comes to the brain, it actually contributes to wakefulness. So when it comes to chronic insomnia, it's something that we've got to think about. Is there a histamine overload? It can cause headaches. It can cause anxiety, dizziness, even tinnitus. And it's just one of the ways histamine affects the brain. For example, you can think of taking a Benadryl, for example, to help you sleep, right? It's so that it diminishes the action of histamine on the wakefulness of the brain. In the stomach, it is supportive in that it makes gastric acid be released. That helps with a whole bunch of digestion, but it can also contribute to acid reflux, heartburn, or even bloating. Bloating is one of the biggest symptoms when it comes to histamine intolerance. It's one of, I think, we read a study recently that said something like, I think 85% of people with a histamine intolerance have this as their primary symptom. Blood vessels wise, we think about histamine dilating the blood vessels. So any sort of flushing, swelling, heat, night sweats, all of that is in response to histamine. If you've ever had the experience of eating a food that you feel like didn't sit very well with you, you might feel hot after that food. That's a sign of histamine. The more common symptoms of excess histamine are the ones in the nasal passages, in the eyes, in the lungs, right? You think of hay fever, right? Sneezing, runny nose, with the eyes, watery, itchy eyes. With the lungs, you think about wheezing or asthma, kind of that constriction in the lung tissue. Skin is related to histamine. For example, if you get a mosquito bite or a bee sting, all different people react in different ways, and that often has to do with histamine. So not just a little itchy spot, but maybe you have a really big bug bite that's very very itchy as compared to your companion you were staying with in camping didn't have quite the same reaction. The other thing we think about with histamine, which is something I clinically forget about, but it's part of why we do these doc talks, is just to kind of to remind ourselves as clinicians as well, the broad spectrum of what these topics hold. But the histamine also has an effect on the heart, in that it can raise or lower blood pressure actually, and it can raise the heart rate and cause some palpitations as well. So this is just something to take in concert, right? Not everyone who has histamine intolerance has all of these symptoms, but it's just the point being is that it's a far-reaching molecule. So histamine has a big role in anaphylaxis. There are many different ways that anaphylaxis can happen. Histamine is one of those ways. It's just an immune response to a trigger, whether it's an oral trigger or an environmental trigger, where you have a life-threatening response that is a huge download of histamine, where ultimately over time, if you can see it in this chart to the bottom right, there's a sensitization of the molecules, the molecules of the body. The immune system sees those triggers and mounts an immune response, and over time that response becomes excessive. especially in the re-exposure time and time again. So common symptoms, you think about the airways constricting, the tongue, lip, throat swelling, vomiting, nausea, diarrhea, dizziness, fainting, low blood pressure. These are signs of anaphylaxis. Like the slide prior, not everyone has all of these symptoms when they're having an episode of anaphylaxis. But it is where epinephrine or an EpiPen can be life-saving in that it kind of diminishes and stops that download from the mast cells of the histamine. So quick slide here, a little bit of an aside, but also very important, is this idea of mast cell activation syndrome, which you might have heard of or might be brand new to you because it's kind of a brand new diagnosis in the last decade or so. Basically, it is a repeated episodes that are kind of near anaphylactic. The symptoms resemble allergies, but it's not totally anaphylactic. It's not totally allergy season allergies. That is very much related to a histamine excess. Remember, the mast cells are the immune molecules that pump out histamines. There's ways we can diagnose it. We test tryptase in the blood during a flare. We want to make sure it's not specifically due to a food intake, like a food that's high in histamine. It's usually initiated from a wide variety of things. Stress can be one of those things, whether it's physical stress, whether it's heavy metal load, EMFs, or electromagnetic stress, and temperature excess. All of these things are things that can bring on this mast cell activation syndrome. The biggest piece that we see, however, and I'm starting to see more of this in practice, is just underlying infections causing this immune dysregulation where the mast cells are dumping way too much histamine in the blood. So those viruses are a whole bunch, whether it's EBV, Epstein-Barr or mono, CMV, chickenpox, herpes virus, COVID even. We're seeing this as an initiator. There's bacterial initiators of this, Lyme disease and the co-infections, parasites as well, and mold exposure being another big one. So how does histamine build up, right? So if you think about why the body does this, ultimately when it detects that something is wrong on the inside, it dilates the blood vessels and causes a little bit of a leaky gut to happen so that the immune cells in the bloodstream can see what the problem is. So that's evolutionarily why histamine is on board. It's so that the immune system can see as soon as possible what is affecting it. This is problematic these days because histamine can build up in certain bodies that are genetically predisposed to not breaking it down very well. And secondarily, we're eating a lot more foods that have histamine in them in our present day humans. So histamine builds up primarily by the sort of intake of it. It's present in many foods in all different concentrations. The biggest thing to remember is as food sits out or on the shelf or as a leftover, the histamine level builds up because of an enzyme made by bacteria in that food that is ultimately processing the food, making histamine as it sits. So foods that are high in histamine are any fermented product, whether it's kimchi or kombucha or alcohol. Leftovers, the longer they sit out, are going to have a lot more histamine in them, even if it's 12-hour leftover. Protein-rich foods that are preserved and processed with any microbes. So think of your canned fish, think of your any of your like specialty meat products that have been kind of packaged and sitting for a long time on the shelf. Your meat sticks, your pickled herring, and obviously if they're spoiled, they have way more histamine than the others. three categories of food that increase histamine. It's worth looking a little bit deeper into this because it's not just the amount that's in the food, right? We talked about histamine-rich foods in the prior slide, but there's also certain foods that promote histamine release through a different mechanism, and those we see with strawberries and citrus. Surprisingly enough, this is also one of the common kind of fruit allergens that we see in our pediatric patients, as people being sensitive or allergic to strawberries. There's a third type of food that can increase histamine, and it's the type of food that inhibits diamine oxidase, DAO. Remember, that is the enzyme that your body has that otherwise breaks down excess histamine. Curiously enough, there's foods and beverages that will inhibit this breakdown of histamine. Alcohol being one of the biggest ones here. And then also worth noting that many prescription medications also affect DAO. We'll get way more into DAO later. Here's a handy list of the histamine content per food. So as you can see, fruits and veggies pretty low on that list unless they've been sitting out. Alcohol beverages start to be a little bit higher on that list, with red wine being on the higher side. Over to the right here, histamine content of fish and seafood way higher, especially from compared to fresh fish to canned fish. You could see that difference in about, just under 14 points there. Meat products, again, fresh meat, there's no detectable limit, but cooked versus cured versus dry fermented, the histamine content builds up over time. Lastly, dairy products down below, especially our raw milk cheeses or even our blue cheeses, that is a huge load of histamine that I think our Paleolithic ancestors were not exposed to at all. So histamine poisoning is something that was first described in 1946 after the government saw there was a big outbreak in what they ended up coining scromboid poisoning with poorly transported canned tuna. So, the scientists and officials put their heads together and said, okay, what happened here, right? It wasn't necessarily gastroenteritis from bacteria, it was something else. And so they dove over time, over these last, 70 years or so. We found more information on this scromboid poisoning described as being a cause from excess histamine in that product, people eating it and having a histamine reaction. We know that this can be caused nowadays by aged cheeses, this type of intoxication from histamine. Symptoms usually start 20 to 30 minutes post-ingestion and get better over a few hours. So think about, again, all of the things histamine does, the biggest symptoms being redness, rash, itching, hives, swelling, local inflammation on the skin. Nausea, vomiting, diarrhea, low blood pressure, which is hypotension, sort of new onset headache, palpitations, even numbness and tingling. All of that can be histamine related.
So you can see these little histamines are pretty powerful. And when we're thinking about breaking them down, we've already talked about this diamine oxidase, which is the DAO. This slide kind of shows you the biochemistry of how histidine is turned into histamine and then how that is converted over with that DAO. And that helps our body rid itself of having this histamine excess or buildup. And there are very important cofactors that are required for this DAO to work, this enzyme to work. So without these cofactors, we aren't able to produce that DAO. And so that's one way that we might end up with a deficiency for DAO is if we don't have things like copper, vitamin C, B6 and things like methyl donors like SAMe on board. So it's one of the reasons why we're often recommending patients take a good multiple vitamin or certain methyl donors to support. And we also are seeing that there is a correlation genetically for some people with not being able to produce as much DAO. And that's even part of some of our commercial genetic screening that's done, like the 23andMe test, for example, has markers specifically for how well someone can produce that DAO. So this I really like this image that shows when we're thinking about histamine intolerance, and this is not our standard allergies, but this is a histamine intolerance of a buildup of histamines where we're not able to break them down and clear them out. You can see this on the healthy individual. You can see that as those histamines go through the intestinal wall and enter into the bloodstream, they begin to be broken down by that DAO enzyme, which they're showing as that little green half semicircle there. And you can see that if the histamines are building up and we don't have enough of the DAOs, that you get this intolerance because the DAOs aren't clearing out the histamine and they're coming into the bloodstream. And then in the middle here, we have this intoxication where there's just such an overburden of the amount of histamines that are released, that they just flood through the system and it overrides the amount of DAO that can clear it out. So there's a big variation for histamine intolerance. Sometimes people have more mild symptomology, whereas others get really several of these histamine derived symptoms from having too much histamine. But it's because there's a continuum here. Everyone's an individual as far as how much DAO they have and how much histamine has been released into their system or ingested into their system. So it can be pretty variable. There's also variation with certain hormones affecting histamine breakdown. And that's kind of an interesting thing when we think about the female hormone cycle in particular, with progesterone decreasing the amount of histamine. And then there's also this importance of timing of the day with histamine, where we see more histamine buildup later in the day. And so people might be more intolerant of certain foods in the evening. Now, when we look at the medical literature and are wondering about this prevalence of the DAO deficiency, we see that there's about 80% of patients who have this DAO deficiency who have symptoms of histamine intolerance. So that's everything from that itchy skin, more issues with their digestive tract, whether it be abdominal bloating or pain. Here we have like constipation and vomiting listed as well, lung issues, we have coughing listed, and then headaches, which we had talked about headaches being a possibility, or migraines even as well from histamines.
So we're looking here at this subset diagnostically of histamine intolerance, right? It's not anaphylaxis, it's not MCAS. It's this more generalized histamine intolerance that often has to do with a deficiency in DAO. So what's interesting about this image is you see all the body systems, or several of the body systems, and you see underneath the bolded sort of titles there, which histamine receptors are involved. And so I want to point out that in the gastrointestinal tract, all 4 histamine receptors are present. So a lot of what we see with histamine intolerance has to do with the GI tract. So, like I mentioned earlier, bloating being one of the biggest symptoms, but additionally also flatulence, diarrhea, abdominal pain. It's just all of the body systems end up being affected. So histamine contributes to what's known as the atopic triad, which is just a fancy term in medicine that means there's these 3 common allergens, or allergies, sorry, that live together. So one patient often has all 3 in different years, might have have one as compared to the other, or might have all three in one certain year. So it's asthma, allergic rhinitis or hay fever, and eczema. We usually see those diagnoses in the same patients. So histamine can bind to the H1 receptors, especially if you have histamine overload, and lead to symptoms that you see in asthma. Bronchospasm, which is the bronchi in the lungs kind of tightening up, airway obstruction, edema or swelling of the nose or the lung tissue, itching of the nose, of the skin, sneezing, right? This is your H1, your histamine binding to the H1 receptor. H2 receptor is the mucus secretion. It's the runny nose. It's the mucus from the lungs. It's the secretions of hydrochloric acid in the stomach. It also is the one that leads to these arrhythmias, or this fast heart rate. So when we think about the atopic triad or seasonal allergies, we think about our antihistamine medications. And this is just to walk you through ultimately what has been discovered over time in medicine and pharmacology for binding which receptors. The H1 receptors, like I mentioned earlier, is going to be really helpful for preventing that swelling or that smooth muscle tightening. And so that's our Benadryl, that's our Zyrtec, our Claritin, Zylal as well. Is that how you say that? I'm not sure. But the H2 receptors are specific for your stomach HCl production, so stomach acid production. So we end up using H1 versus H2 blockers, these two types of antihistamines, in much different ways. If someone has acid reflux, I reach for my H2 blockers. If I am going the over-the-counter prescription route. We'll talk later about some excellent herbs that do the same thing. But I also want to point out that these prescription medications have a slew of side effects associated, which are drowsiness, cognitive impairment, increased appetite. And so it's just worth thinking about, friend or foe. Is histamine helpful or hurtful? It's a little bit of both. As we inhibit it, it's helpful in a high histamine state, but it also has these side effects that would otherwise, not have been present. So here's a slide on new research for a low histamine diet in the treatment of eczema. And what we noticed here, the scientists noticed, is that just after 2 weeks, a histamine-free diet was so a histamine-free diet and an oral antihistamine together made a significant improvement in the histamine intolerance symptoms, headache, flushing, GI symptoms in patients.
So we know there are so many histamine receptors in the gut, and we also know that one of the main sources of histamine can be from our microbiome, which is the majority of which is in our intestinal system. So there's a very direct link between histamine and a gut microbiome that has been disturbed. And the name for that is dysbiosis. When our good flora has been shifted, whether we have an infection or just too much of certain types of bacteria, fungus, or even other types of microbes, we can have problems with dysbiosis, and that will often lead to a problem with the histamine regulation. So here's a cool study that talks about how histamine intolerance originates in the gut. And this is a big deal for us as naturopathic doctors. We always are wanting to look at what is the root cause. So a huge takeaway for you guys today really should be, okay, if somebody's dealing with histamine issues of too much histamine, then healing the gut has to happen. It is primary to addressing that excessive histamine pathway. So, when we are thinking about ways to really correct this, we're wanting to make sure that we're healing the gut, and that's allowing this DAO enzyme to do its job to successfully be able to clear through the histamines. And then that will help the gut not be so permeable and leaky, so excess histamines don't get in. Now, we also know that there's really cool research coming out about how the microbiome itself is affecting histamine. And we know that there's a very important communication between the cells of the microbiome of these, once again, bacteria, fungus, and then some other types of microbes that help communicate with the nervous system of the gut and that helps communicate with the immune system of the gut. And that's where the mast cells are laying right there underneath that layer of those intestinal cells to help communicate whether or not there needs to be releases of histamine if there's an infection. And so this is supposed to be protecting for us, but depending on the types of microbes that are there, there are even some that can actually diminish the DOA and break them down just by function of how the microbes metabolize fuels around them. And so we know that this increase of histamine secretion can also happen anytime the body is seeing or perceiving dysbiosis or abnormal flora. And we specifically know that there are certain flora subtypes that are attributed, according to the medical literature, with producing more histamine. So the body is seeing that imbalance and saying, something's not right. We're going to put the immune system on high alert. And so we've listed some of these out here for you. This is a picture of one of the test results examples that we get back from a stool sample that we'll run with some of our patients. And we really like these PCR stool analyses. They really help us understand what's going on with a patient's microbiome. And when we're concerned about something like histamines, this can be a really phenomenal piece of data for us to determine what's going on with your the patient's intestinal health. Do they have the right cornerstone bacteria and the good microbes there to help reduce histamine production? Or do we have an overgrowth of certain ones that are going to make too much histamine and really fuel more of this leaky gut process? And you'll see starred here, there's under our list of microbes there that are implicated for producing too much histamine in the gut. We see zonulin. And zonulin, although it's a very funny name, I think, because it sounds very sci-fi to me, but it's a very important um, piece of our gut story when we're talking about permeability, because it is this portion between our cells that sits there and helps regulate how permeable the gut is in between the cells. So what can slip through between our intestinal cells to get into the bloodstream? And so when we have elevated zonulin upon these tests, we know that we have increased intestinal permeability. Now, remember, part of histamine's job is to cause this vasodilation and to cause more permeability so that the immune cells can quickly communicate. Alert, alert, foreign invaders. We need to mount an immune response quickly. So we associate a lot of intestinal permeability with high histamine reactivity. So it's always a great thing to understand for our patients. Do you have high zonulin? Do you have excessive intestinal permeability? How long is this road to healing your gut going to be? That's very helpful information.
So histamine also contributes to neuroinflammation. So it has an effect on the central nervous system. Here's a research article on histamine's role in migraines, in that it essentially sustains the inflammation pathway. And we did a doc talk on migraines just a few months ago where we talked a little bit about calcitonin gene-related protein, CGRP. But histamine, if you think back to that talk, histamine actually promotes CGRP, which is just an inflammatory pathway in the brain, in the blood vessels of the brain. So it just thus sensitizes the nerves that lead to the headache and the migraine. And so histamine binds to it crosses the blood-brain barrier, first of all, and it can bind in this way that is highly inflammatory in the brain. So this is, something that you might have heard of it as being a treatment protocol for migraines or chronic headaches, is just a low histamine or a low tyramine diet. These are both inflammatory amines that cause a downstream cascade of inflammation. So we'll walk through here some natural antihistamine support that has, and we'll talk through these 4 herbs and foods that are going to be really helpful to have on board. So ginger is the first one. What's excellent about this, about ginger, is that it's a food, or it's a supplement, or it's a tea. You can kind of take it in as many ways as you'd like, but ginger extract is as good as loratadine, which is an antihistamine for seasonal allergies, in improving the nasal symptoms and quality of life in people who have acute allergic rhinitis, so hay fever. So ultimately, that's really exciting for us to see, is just that nature is as effective as the prescription. And the biggest thing also to know is that ginger has less of the side effects that are caused by these otherwise these antihistamines that are over the counter. 500 milligrams of ginger was where they started with. It was the dose they started with for just 3 weeks in this randomized double-blind control trial. Nettles, this is the time of year for those, at least in the Pacific Northwest. Nettles, curiously enough, they, can cause a histamine reaction on the skin, but when you process them and take them orally, they're actually a really potent antihistamine. And you can have nettles as food. You can make nettle pesto, or you can have it as tea or encapsulate it. Ultimately, what's amazing about nettle is that it binds the H1 receptor, which we talked about is kind of what Benadryl does as well, and inhibits those mast cells from pumping out a whole bunch of tryptase and histamine. So nettle, that's one of the ways that it works. It also inhibits prostaglandins, which are ultimately an inflammatory molecule. And it inhibits it through the COX-1 and COX-2 pathway, which, in pharmacology is just the pathway that gets used for our NSAIDs, our Aleve, for example. So it's got both this pain-relieving, anti-inflammatory perspective, and it's also got this antihistamine blocking perspective. It's so cool. I use nettle quite a lot, and I see it clinically work really well. Quercetin, additionally, pretty potent antihistamine. It's found in all sorts of food, citrus fruits being one of them, apples, onions, parsley, tea are all good sources of quercetin, onions. Its anti-allergic action is through inhibiting the enzymes and the inflammatory mediators as well. So similar to nettle. And it's, biggest piece here that is part of that's really important to track is that it inhibits the mast cell degranulation or activation. So mast cells, remember, hold on to the histamine until it's needed. So preventing them from doing that big dump is really important. Lastly, curcumin, or the active constituent in turmeric, is another potent antihistamine. We talk about we talk about turmeric all the time as just this amazing anti-inflammatory, but what's also so cool about it is that it again inhibits mast cell release. So histamine being a modulator of the inflammatory cascade, it makes sense why curcumin is touted as this just amazing anti-inflammatory.
So there are times when it is really helpful to have certain um, nutraceuticals in milligram amounts, and that's when we'll often be reaching for things in our apothecary. And we've got an apothecary here at Prosper in person here, as well as an online portal for people to go in and get supplements through. But the things that we often curate for our patients that we're worried about having excess histamines include things like actual DOA. So we can actually give this enzyme, which is very, very helpful. And you'll see this product over here, this Histogest DAO. We really have been very happy that that's now available. It wasn't several years ago, but now being able to provide that for people before they eat foods that may trigger, or just to help them reduce the amount of triggering that they have of histamine release from just even more normal food if they have a deficiency, can be very, very helpful. So that's one option, is providing the actual enzyme to help break down the histamine. Also, standard digestive enzymes can make a difference for some of our histamine intolerance folks. And this is because anytime we're helping the gut rebalance and helping with our microbiome and shifting the correct pH in the intestinal system, that can be really helpful. So sometimes we'll add those in as well. We also want to be thinking about cofactors for helping the body build its own DAO. So this is something that we're thinking about with our methylation factors. So something like trifolamine, which has our B12 and folate. Supplements that have SAMe can be really helpful here as well. And then looking for cofactors, which often will come in a multivitamin, like our B6 and our copper and our zinc and our vitamin C, to help with that building of that very important enzyme. Now, other products that we'll often be reaching for are similar to those ones that Dr. Rosalie just reviewed. So we love using quercetin. There's an awesome quercetin product called Quercetin Ultrasorb that Pure Encapsulation makes that we just adore. And this is very well absorbed quercetin. It comes in 500 milligrams per capsule, and it's one that we will use with patients to reduce that histamine overload and that histamine response. Of course, curcumin, so that's that turmeric extract that we were just talking about. There's several different forms of that we use. Sometimes we'll use capsules, sometimes we'll use gel caps, other times liquid. Really depends on what the patient is needing. One thing that you will notice in these products that we really recommend here at Prosper in regards to the curcumin is that they do not contain black pepper. And that's really important to us because patients that are dealing with a histamine intolerance are already dealing with excessive permeability of their gut typically, and part of the healing of that excess histamine overload is going to be helping to initiate the proper gut lining and not having too much permeability. And black pepper, which is found in a lot of the over-the-counter products for turmeric, can really cause the irritation of that gut lining. It's actually why it's in that product, to make the turmeric absorb more. But instead, we use pre-bioconverted forms that are going to be easily absorbed, and you don't have to use something like black pepper to irritate that gut lining further. We also will use things like um, our lovely ginger and nettles as well. And so we see those in products like this Aller Essentials, and BCQ is a cool one because it's bromelain, it's curcumin, and it's quercetin. So it's all three. So sometimes there's times that we want to use multiple different types of antihistamine herbal products as well, and extracts. And the same is true of this histase here. It's got several different, including our quercetin and our uh, curcumin and our nettles in it. So that can be a really handy option for some people.
So one of the best ways to know whether you have some histamine intolerance is actually to do a low histamine diet trial for 4 to 8 weeks, where you're pulling out those high histamine foods to see and keeping a diet diary and a symptom diary to see whether you are noticing an improvement in your GI symptoms or the heat intolerance or the headache. And so when we talk about a low histamine diet, there ends up being a whole lot of recommendations. And so we found this review that looked at all the low histamine diets in the literature and tried to compare which ones agreed on which things. And so on the right-hand side of this chart, you'll see over 60% of the diets that are low histamine agreed that we've got to remove these following items: cured, semi-cured cheeses, grated cheeses, right? It's sitting on the shelf for a long time. Oily fish, canned fish, dried fermented meat products, spinach, tomatoes, cabbage, citrus, strawberries, wine, and beer. Okay, those end up being kind of the A list for removal for 48 weeks on a low histamine diet. Shellfish, eggs, fermented soy, eggplant, avocado, banana, kiwi, a whole bunch of other fruits, nuts, chocolate end up being a little bit in this middle ground. Some scientists say yes, high in histamine, others say not so much. And so, what I end up recommending to patients, it depends on their symptoms. Of course, if it's really high histamine load, I'm going to say remove all of that. And if it's just we're trying to try this out, I usually say, okay, aim for 1 to 2 times a week, something from that category. But definitely removing the other ones in the over 60%. So yeah, if you end up Googling a low histamine diet, you'll see it's a little bit all over the place. But at the end of the day, what is worth remembering is, first of all, the high histamine foods are the ones that have sat out for a while, including your leftovers, including alcohol, and beverages that have sat for a while, fermented foods, canned things, and yeah, doing a 4 to 8 week removal of that will sort of help you figure out whether you do have an intolerance. Tips for reducing its histamine is to eat your foods as fresh as possible. And if you've got to meal prep for the following days, just to freeze them once they're down to temperature so that you can really reduce the histamine load. Frying and grilling foods increases histamine. Boiling, it does not. So it's just, again, thinking about are you making a whole bunch of stir fries or are you eating your boiled veggies? Again, it's just figuring out where you land in the histamine world, what you can get away with. Alcohol, high in histamine, which certain people will experience a histamine reaction after alcohol, and sometimes it gets attributed to sulfites or a sensitivity in the alcohol itself or the wine. But sometimes I want to point out it's also very much due to histamine. Slow cookers can increase histamine load, and that's because they sort of steam they let that food sit for a long time, and so the histamine builds up. Steamed versus pressure cooked, much better at histamine management. NSAIDs, an over-the-counter anti-inflammatory, is a diamine oxidase inhibitor. So if you're having NSAIDs frequently, your histamine load is probably going up because your DAO is not able to kind of work through those histamines. Fasting for 24 hours, just a water fast periodically, also really helps reduce histamine flares. And this is something that I know is hard to do and needs a little bit of physician guidance. But I have seen this be very, very powerful, a powerful treatment tool. And then the biggest piece here is if you're improving with your diet, with a low histamine diet, it confirms that you have a level of histamine intolerance, without needing any extra lab tests or whatnot. At the end of the day, if you've identified that, we've got to figure out the root cause of that intolerance. And basically, it starts with a protocol where we're healing the gut, healing that gut lining, making sure there's no intestinal permeability so that DAO can increase. You can have better food tolerance to high histamine foods. You can start to reintroduce those foods.
I think that's one of the most exciting pieces for me about going through this whole, newest research on histamine was just remembering that histamine intolerance is treatable. This is a very hard diet to implement for that 4 to 8 weeks. And it does pay off, which is really great if you can get to the root cause and help heal that gut in particular and really support that DOA. So as far as, that goes, if you guys are having questions or need support, we're always here to help. We love working with people with their microbiome and their intestinal system in particular, but always happy to help whenever histamines are at play because they really do affect so many different tissues